Everything is growing, changing, and evolving, even you. From the student nurse to the baby nurse, veteran nurse off the bedside and into entrepreneurship, you have arrived and you have evolved. So, welcome to the Evolve Nurse Podcast. It is your host, Keish, and we are back with another episode. Now, this is your first time seeing me on camera, right? It's your first time seeing me on camera, aside from my TikToks, Facebook, or Instagram posts. But I'm here today live. And if you know anything about how I do my podcast episodes, I do them in interview style. Sometimes I do them solo. So today you have me here solo, but I do them interview style, and sometimes I do them in my closet on the top of a storage bin with no camera action. And that's because I normally don't have space to actually do my podcast, but I am working on my closet office. And so I have done some things to it. This background is not my closet. But I am working on it so that I can bring you more interview, face-to-face style content, because I know that you want to have a face with a voice and to be able to actually put two and two together. So, first and foremost, I have not formally done a intro episode. And out of all 23 episodes, I have not told y'all who I am. I mean, I know you know a little bit about me based on what I've told you on the internet, but in all honesty, I haven't told you a lot about me. So here is a little bit of an intro episode, but then I want to get into finding your confidence as a nurse, because I do know that you just started school, and I want to kind of help you navigate those feelings of helplessness during this time. So, who am I? A nurse. No, I don't just identify as a nurse. I feel like I am more than a nurse. I am a nurse, a mom, a partner, a daughter. But how did I get here? How did I get here? Well, I didn't e- initially, I did not want to be a nurse, y'all. I went to undergrad, got my bachelor's in biology, and while I was navigating that program, something happened. My biology program, where I was going to go to PA school or go to med school, they did not lean heavy into med. They didn't lean heavy into the healthcare field. They leaned more towards research. And so a lot of our preparation during our biology program was research based. Even in our clubs, we would go to schools that did research. So me and my cousin, we went to our dean and we straight up asked him, we like, yo, do we have any internships that we can go to so that we can be able to navigate going to med school or PA school? And he was like, no. Straight up, no, y'all got to kind of do it yourself because we don't have that type of program. Now, why do you have a pre-med track but not have pre-med opportunities? So we put our foot to the pavement. We went to the hospital. We signed up for their job shadowing. We went from place to place around the town that we were in and found GYN sports medicine. We shadowed the hospital and the OR. We did so many things, but we had to put our best foot forward ourselves. Our school didn't give us those opportunities. So when I say like we really had to grind out, and at the time I was working at Lowe's. So I'm at Lowe's one day and I'm with one of my coworkers, and he was like a brother to me. And he saw a doctor walk through the door. He was like, what's she doing here? Because he also worked at the hospital. And I was like, oh, because now I'm all ears, because I'm like, I need to shadow anybody that I can to see what I want to do. And that's one thing that students, if you're looking at this, that you have to do. Sometimes you have to look at opportunities as they are, as they present themselves, because don't miss out on something because you're scared. And normally I'm scared, but I knew that I'm coming into my senior year. I don't know what I want to do. I'm shadowing all the PAs, the doctors, and what they're doing is not appealing to me. And so I was like, do you think she'll let me shadow her? And he was like, yeah, go ahead, go on and ask her. You know, she cool, she cool. So I went up to her and I was like, hey, my name, and her name is my name. And I asked her, I said, hey, can I shadow you? I'm going into my senior year. I'm trying to figure out what I want to do. I have my bachelor's in biology and she had her DNP. And so she was like, yes, on Monday, send in your paperwork and then you can start. So I started shadowing her and I saw the way that she navigated with her patients, how she knew their stories, how she treated them holistically. And that made me want to do what she did. And so she told me, she said, Keisha, if you really want to do this, you can go to the school that I work at. I'll do your letter of recommendation and I'm sure that you'll get in. And so you should start working on doing this. So this was my junior year before I went into my senior year of college of my biology program. And so that's just what we did. She gave me a letter of recommendation. I got another letter of recommendation, applied for that school and waited around. Now, what ended up happening was in order for me to get into that school, I had to take a prerequisite class, pathophysiology. And so that was not offered at my school. I actually had to go to that school that I would want to go to and take that class. So what I ended up doing was I had to dual enroll. And mind you, these campuses are hours apart. So I had to put the work in. And if you know anything about my story, like I worked 3 jobs. I'm like, when I say grind out, I have been grinding for a very long time. And I don't think I give myself enough credit because we are sometimes our own worst critic. But when I look back over my story as I'm telling y'all, I really worked hard to get where I am. Don't cry, Keisha. But in reality, like I had to drive from my school, my home school where I worked, to another school. And when I tell y'all, Patho was a beast in itself. It was very hard. It was my first introduction to what nursing questions would look like. Had no idea what that structure would look like. And so I struggled through that class. But I ended up passing with a B and still didn't know whether I had got into the program. And so I'm like, okay, well, if I don't get into this program, I take my GRE, I can apply to go to PA school because at this time I have all my hours to be able to go to PA school, right? Because I worked at a nursing home. I started off in the kitchen, worked my way onto the floor, and did some private care help for families. And so I did all of those things in my freshman and sophomore year of college. And so I'm like, I have all my hours that I need in order to be able to get into PA school. My GPA is okay. Um, I think I passed my GRE. I'm not sure what my GRE looked like. Honestly, it has been 5 years, and that's something that I have recently revisited to see how I did on the GRE. And this is like a sidebar for students who are coming from backgrounds where they didn't have to study. Like everything came easy to you in high school. Like all you had to do was skim or in class listen a little bit, and you did great. I was that student, the overachiever who really didn't have to study. But when I got to college, it was different because it was a different level of responsibilities. And so that really took a turn in what my academic career looked like. So I will say for you, give yourself some grace, but also learn how to stack your responsibilities because that was the issue for me. I didn't know how to prioritize what responsibilities went where. And it showed up in my grades and how I was able to maneuver working, school, and being a child. Like still being a child, still being there for my parents when they needed me. So that was something that I had to deal with. And if that's you, give yourself some grace. Okay? Let me turn this up. My lighting is acting up. Well, it's just gonna have to do. So yes. I got accepted. On my graduation day, I actually ended up having class. So I didn't get to go out and eat with my family. I didn't get to do all the normal things that a graduate would do. I had class on the same day that I graduated school. So I started my nursing program. And with that, we're going to get into the meat and potatoes of where my lack of confidence came from in nursing. So, because I don't want that to be where you are. So, first, I'm going to start with my doctorate program that I'm now in. My teacher in my doctorate program started her lecture off with, "I am not weeding any of you out." She said, "I'm not weeding any of you out. You all will cross the stage. If you need time, if you need anything, you reach out to me." That set precedent for how I feel about my doctorate program. Now, let's go into what my undergrad program looked like. It looked very much like we're weeding you out. It looked very much like we're weeding you out. You're not going to pass. We're going to give all of the resources to everybody else, but we're not going to give it to the people who look like you. We are weeding y'all out as you speak. Everybody will have different experiences in this program, and it's not going to be fair, but we don't care about that. That's what I went through in my program. Like, very much the bullying, the bullying that you feel from your nurses, it starts in school. It starts in orientation. It starts in your clinical when you don't feel confident and you go talk to your teacher, but they make you feel bad about yourself as if you're supposed to know how to do these things already. It starts there. Nursing confidence has to be built upon, right? And mine was almost diminished. And when I tell you, like, my friends that I've met in nursing that I work with, my friend that's a scrub tech, she was my first scrub tech, and she was like, "When I met you, I knew that you had it." And I was like, "Well, girl, I didn't feel like I had it. I felt like in my head, I'm going, I don't know what's going on. I don't know what's going on. I don't know what's going on." But I never let it show in my face. I still showed up as competent as I could be. I still asked questions when I needed to. I leaned heavy on my scrub techs. And anybody who is in the OR, remember that your scrub techs know a lot, especially if they've been there for a long time. Lean on them, respect each other. Y'all respect who you're in the room with, and I promise you, you'll have a great experience. Now, sometimes you're going to run into some surgeons, right? They not going to like you because they don't know you. And then when they get to know you, they start to warm up, and then they start leaning on you heavily. But I've had surgeons come to me and apologize for how they treated me. But at that time in my life, when I tell you, it was hard for me to understand and recognize how amazing I am as a nurse. And I got to give myself a pat on the back, because when I tell you I'm there for my patients, I'm there for my patients. Even when I was on the floor, I was there for my patients. My patients were everything to me. Okay. Now that looks a lot different. That, y'all, now that looks a lot different, right? I started off in residency. So I graduated from my nursing program, went straight into residency. And once I got into residency, I started off on a float unit. So I went from hospital to hospital on a PCU ICU floor. So I went from, because we have a huge system here, and within that system, I went from hospital to hospital. And so once I was 6 months into my residency program, they were like, "You have to find a home. This particular job, it requires you to have 2 years before you can actually apply." And so I ended up doing like a shadow day on this unit. I should have known something was fishy. I should have known something was wrong, right? Because Right after I was done with my shadow day, I get a call from my preceptor that was like, they really like you. Do you want the job? And I was like, sure, I want the job. It's PCU, ICU. I get the experience. It's a specialty. Of course I'm going to take the job. Y'all, it turned into a full-blown COVID unit. A full-blown, not one bed was not COVID. And even at one point, I think we tried to introduce a non-COVID patient to the unit and it just didn't work. We were all just we was just the COVID nurses. Like, that's who we were. And so when I say like COVID burned me out because I built such great connections with my patients, and I would go like on my 4-day and I would come back and they will be gone. And I remember going to my preceptor and being like, how do you get through this? And she would come to work every day with her Bible in her hand. One thing about, actually, she was going to have the Bible. She is episode either 2 or 3, Nurse SWAT. And when I tell you she made a huge impact in my life, made me the nurse that I am today. Like, I've had some really great preceptors who have poured into me, who saw me when I didn't see myself. So you will come into contact with people who will see you. They will see who you are, see what you can do, see the type of love and things that you can share in this nursing space, in this healthcare space, even when you don't see it yourself. So when we sat down and we talked, I was like, I don't think I can continue doing this. Like, seeing patients pass away day after day after day, and knowing that like they were trying to increase our responsibilities but not increase their pay. And so I was like, I think I need to do something else. Like, I have to do something else. So I went from there to rolling into the OR. Now, when I say I rolled into the OR, it's not something that they wanted me to do, right? I actually had a lot of blockages and obstacles in the way of me getting to the OR. I don't know if it was because I was a good worker or if it was because sometimes they don't want people who look like me in those spaces. And I say that because of the way that like emails went down. When I emailed the people I needed to email to say, hey, I haven't completed like all my residency, but I can roll over into the residency program for the OR and finish there. And so they gave me an interview, right? They gave me an interview before they reached out to the conglomerates, before they reached out to those in the school or in the education program. So where they didn't really want to let me go, like I had already had the job, like I did my 30 days out. They really wanted me, so I went over into the OR. As soon as I get to the OR, they shut the OR down. They shut the OR down and they put me back on the floor. Now, I'm trying to escape the floor, right? Like, I'm sick and tired of being sick and tired of being on the floor. Like, I am trying to escape the floor. And I couldn't get away. I could not get away. So I ended up being on like this makeshift unit where it was like short term patients rolling in, rolling out, and it's me who has a little bit of experience, and it's an OR nurse who has literally no experience on the floor. At first, we had a charge, and then it was me, and I was basically training her while I'm trying to get stuff done. It was a point where they didn't give us a CNA. It was a point where I had to literally fight for CNAs to come down and just give us some type of resource. So I ended up going to the director of the unit, and I was just basically like, look, I can't do this. It's going to affect my license, and I don't feel like this is safe practices. Y'all aren't giving us a CNA. Y'all aren't doing the things that y'all need to do. And I said, at this point, if you feel like these are the things that's happening, it's time for admin to come out of the offices and onto the floor. And he said, well, I don't understand why everybody is just so up in arms, because I had somebody on the floor tell me they wouldn't take an eighth patient. And when I tell you, I looked at him. I said, I wouldn't take an eighth patient. Do you understand how unsafe that is? Y'all need to come out of the offices and come onto the floor, because then you'll see what we're really going through here. And so I ended up reaching out to the person that's over my program about my contract. I said, hey, my contract is for the OR. If I said, if I end up leaving, will I owe anything? And she was like, you're thinking about leaving? I said, if I have to. Yeah, if I have to. Because I left the floor for a reason. I left the floor during COVID for a reason, because when I tell you, it was just so hard going through that every day, living through that PTSD every day. And so, no, I can't do it. And I'm not going to do it. So in a week, they ended up opening the OR back up, and I was in the OR. So I've done some work in the OR. Before I went to travel, I was travel in the OR, done some trauma work, as well as now I'm a pediatric charge. And so on a trauma OR unit. And so now when I tell you, like, learning how to play as a team, I've always been a team player when it comes to being in the healthcare field, because everything we do is a collaborative function. And I stand on that. I have to work with the scrub techs. I have to work with the CNAs. I have to work with the doctor. I have to work with the PA. We have to work with pharmacy. We have to work with administration. We have to work with EVS. My doors be breaking down, y'all. I be calling plant facilities. My cryo machine go off. I have to call plant facilities for them to come and take out one nitrogen tank and put in another one. We have to work with vendors. Like, everything we do is collaborative. Everything we do. So here is where your nursing confidence comes in. And I'm going to start with the student nurse. So with you being a student, everything that you're doing right now is hard, right? It feels daunting. Sometimes you feel like, why do I have to do this? Sometimes you're feeling like, why am I feeling so overwhelmed with the stresses of doing the tests, doing the papers, going to clinical, having a test the day after clinical? All of those things are very, very daunting tasks. I hate using the word daunting. That's a word that I use a lot. But when I say that they are daunting tasks, I mean, like, why am I doing this and how it's affecting you? It can show up in your test scores. It can show up in your confidence. It can show up in how you treat your patients. And when I tell you it's okay to give yourself some grace, it's okay to breathe, it's okay to do all of those things. And you need to, right? You need to breathe sometimes. Sometimes you need to take a break from studying. Like, you're overloaded. It's no way that you're that overloaded and you're going to retain any more information. It's an episode, it's called Not You Passing the NCLEX in 30 Minutes. Go listen to her, because she is of the belief that, I only can give what I can give. I only can give what I can give. And with that being said, like, really and truly, you only can give what you can give. And if you overextend that, it's going to be a lot harder. And that was who I was. I was an overextender. Like, I was stressed out all the time. And my friend who had a baby, she used to come in, it will be what it will be. Like, it literally was what it was. And she would pass her exams. And I, on the other hand, who had 50 million pounds of anxiety on my back, y'all, I would struggle because I was so scared. Like, it was a point where I had to reframe my mind around what test look like. And I had to tell myself, the words on the test ain't gonna get up and punch me in my face. They're not gonna take my money. Give me my money. They're not gonna take my money. They're not gonna, like, the words on the test are just words, and the information is what I obtain. And if I can have confidence in myself enough to know that I know the information and know how to apply it, then I will be able to be so much better. So what I ended up doing was, I started changing what I listened to. I started changing who I hung around. I started changing how I felt about myself, my self-confidence. And when I did that, I saw my test scores go up drastically. And this was after I failed the semester. So don't think that after you failed a semester, life is over. An episode with Nurse Lawyer, your Nurse Lawyer, she said the semester that she failed and she had no nursing classes, that was the best semester of her life. So similar, like I took an African American studies class. I worked. I had a good time during that time. But also there were times where I was like, dang, I really failed. I'm a failure. And you're not. If this is what you want, then go for it. Now, is it always for everybody? No. And sometimes we have to also be realistic with how we feel about nursing after we go through the trauma of nursing school. Because sometimes that trauma needs to be dealt with through a therapist. Like, go to therapy. You need to be talking to a therapist. Because I definitely, during that break, I went and saw a therapist. Because it was just so hard. Like, and if you have friends that are outside of nursing, sometimes they don't really understand like why you're feeling the way you're feeling, why you can't go where you're going, why you can't be as available. And so when you're going through that and you're going through the grief of losing friendships during that time, you're going through the grief of losing who you were. It's a hard time, but I really had to put my best foot forward. So I started listening to inspirational speakers like Les Brown, Lisa Nichols. I started getting up in the morning and meditating for 60 minutes and envisioning what my day would look like. I started writing down my goals for the day to see where I'm doing the best, where I'm doing the worst. I stopped looking at people who were anxious. So before test, I would put my headphones on. I would listen to J. Cole Motivate. And I would not look any of my classmates in the eye. I didn't want to talk to them about what they thought was on the test, what they didn't think was on the test. Because this is where we mess up. We go and everybody's anxious, right? Everybody's anxious. We go and we talking to our classmates like, what do you think this is? Like, what do you think that is? And give me a rundown on acid basis real fast. And all of a sudden we get on the test and we're looking at it, we're like, hold on, what did she say? And sometimes they don't be knowing either. And so now you're trying to pull from your brain what they just said 3 minutes ago and you really don't understand it. But this nursing test is application based. So you have to know how to apply it. So I started structuring how I would study. I have a study guide on MedPrint Shop on Etsy. I'll link that in the description. And it goes based on how you apply. Like, what's the pathophysiology? What does it look like? If you have a patient who comes in showing this, and this symptoms, what are we going to do? What are your ABCs? What medications are you going to give? Once you discharge them, what are those what education will you give them? What demographic? Because they love a demographic question, right? They love a demographic question. So who is most often to have this disease? Those are the things that they want to know. So if you break it down like that, 9 times out of 10, you're able to structure your questions. You're able to talk through them. You're able to critically think through them. And learning your critical thinking skills is also another thing in itself. And I'll do another video on that. But understanding what your nurse confidence is. Your confidence starts in nursing school and your nursing test. Have confidence in yourself. Regardless of what they say, you always remember who you are. I'm sorry, y'all, my background is glitching. You always remember who you are at the core of everything. You came into this program as a student nurse, not knowing what to do. Your instructor said that everybody ain't gonna make it, but you know that internally you're gonna make it. You're gonna make it. So at any given moment, remember and remind yourself that regardless of what people say to you about you, you are who you are. And you keep that here at the core, at the center of who you are, at the center of your being. You keep that close to you. Because as soon as you, in episode 1, Travel Nursing Saved My Life with Danielle Hudson, she has a very particular story in how, confidence, once you let them get into your head, they can destroy your confidence. So what you have to do is always remind yourself of who you are. Every day remind yourself that I'm going to make it through this program. I know what I want to do. I know who I want to be. I know my why. What is your why? Remind yourself of what your why is. Because if you lose sight of that and then allow them to get into your head about who you are and them project their feelings and insecurities onto you, you will end up broke and destitute. I'm just playing. You will end up similar to me, where it was very hard for you to get back on track. And so once I started implementing certain things into my life, cutting out negative speech. Sometimes we are our worst critic. And would you talk to people? Would you talk to someone else the way that you talk to yourself? 9 times out of 10, no. You would encourage them. You would pour into them. You would give them all the tools that they need. But what we end up doing is we beat ourselves up. We beat ourselves down. And we end up like destroying every fiber of the person that we was. So with that being said, like, get it together. We are 3 weeks into school. We're 4 weeks into school. Work on your self-confidence. Listen to inspirational and positive people. If you have people in your life that are telling you, don't do it, it, I don't even know why you're going to, you even have parents that will tell their children that. I don't even know why you're going to school. You're not going to, cut it out. Cut it out. The people that are going to be there for you will be there for you, and the people that won't, they won't. But you have to understand and recognize who you are as a person. Who you are. Not who they want you to be, but who you are. And building on your nursing confidence in nursing school will help you tremendously when you get into the profession. Because once you gain your nursing confidence, I'm not talking about nursing cockiness, but nursing confidence. It'll allow you to be the nurse who doesn't always second guess what they know is right. Now, if you are second guessing, it's definitely okay for you to go and ask a question. Now, go and ask your preceptor, and hopefully you got a good one. Ask your preceptor, ask the person that's beside you what they think. And if all else fails, you got Lippincott. If all else fails, you have orders. If all else fails, talk to somebody. Nursing confidence is not the same thing as nursing cockiness. I've seen nursing cockiness, and it looks like I know all things. You go into being a nurse, and anytime, even when I change a specialty, or when I go to a different unit, or when I go to travel and I'm on at a different facility, I strip myself of who I was at the old facility. And I say, I'm here to learn. Teach me. What do I need to know about this position? Because we always have to be teachable. Nursing is evolving. Nursing is evidence-based practice. Nursing is understanding that where you are today is not where you were yesterday. And knowing that we have to learn how to change with the times. Nursing is a practice. We're practicing. We're never sedentary. Everything is not set in stone. As science develops, we develop. Years ago, cigarettes helped the people. Years ago, cigarettes was medicine. Today, it's the cause of cancer. Years ago, cocaine was a medicine. It's still a medicine today in ENT surgeries. But it was a medicine that was utilized a lot. Now, not so much. So, because I haven't seen ENT surgeons outside of the one that I used to work with who was a diverter, who did struggle with some addiction issues. He used cocaine for his surgeries. So, when I say that, nursing evolves and changes. We evolve and change. Evidence-based practice evolves. So we have to be able to be teachable, because if we're not, we will be stuck in the same places that we were years ago. And that's not okay. And you see that in nursing. Like, you will see people who will tell you, like, I've been doing this for years. And those are people who they have to go through their own learning choices and figuring out where they are, where they want to be, and that's kind of up to them. And you only can do what you can do. And even if you're a new nurse, don't feel like people can't learn from you. If you're a new nurse, 9 times out of 10, you're more diligent. You're looking at things with a brighter eye. You're noticing things. You're observing more, because you don't know what's going on, but you kind of know what's going on, and now you're questioning things. So lean into those questions. Lean into that curiosity you have, because once you lean into that, you become a better nurse. So be confident in what you do. I remember, and it all depends on where you are. I remember one of my nursing cohort friends posted on Instagram. She was like, "How do you take out a Foley?" It kind of depends on what you've been exposed to once you leave school. Like, we ain't been in school in 4 years, 5 years. So if you haven't been exposed to this, how do you do it? Lippincott. Lippincott will tell you how to take out a Foley. I'm always putting in Foley's. Always taking out Foley's. I'm putting in IVs, taking out IVs. I'm doing all of these things. But there are certain skills that I just don't do anymore. Like, I speak to patients' families now. I make kids feel safe now. But am I giving meds around the clock? No. I'm probably going to pull some out the Omnicell, bring it in the room, give it to the field, and wiping my hands. Am I scheduling anything? Like, yeah, I might put a case on the board. Those are tasks that I have. But as far as skills like doing med pass and things like that, that may be a skill that if I decide to go back to the floor, that I'm a little, not hands on. Like, I'll ride a bike. It might take me a shift or two, but I'll get back in the swing of things. But at the same time, y'all, get your nursing confidence. Don't let anybody break it. Because when I tell you, they will try. And they can try as hard as they want to. When you recognize who you are on the inside, in your heart of hearts, and know who you're meant to be, keep pushing, keep going. Because when I tell you, like, we need more nurses. Now, is nursing an easy profession to be in? I'm not going to lie to you. There are some areas that are more crazy than others. There are some areas that require more energy than others. It just kind of depends on what your why is. I know people who have been on the same unit for years and they love it. And I came on a unit, I was like, did I really have to go through this? So when I tell you, like, there are areas where you will love, there are areas that you won't love, but nursing allows for you to be able to look at all of these things, to go to all of these specialties. Make sure that you have your resume up to par. Anytime a new skill comes, drop it on your resume. Because look, you can do whatever you want to do. You can be who you want to be, and as long as you keep your confidence up when you go into these interviews and you tell these people who you are, what you're about, how you coming. When I look, the sky is literally the limit. It's not even a limit. You can shoot. What did Les Brown say? Shoot for the stars. Because even if you shoot for the moon, but even if you miss it, you'll land amongst the stars. He said a word, didn't he? He said a word. So y'all need to go listen to Les Brown, because Les Brown is going to get you what you need to get. Also go listen to Lisa Nichols, because they are really going to help you become the people that you need to be. As far as gaining confidence, not looking at the short-term goals, looking at long-term goals, and just making sure that you are who you want to be in this nursing career. So find your nursing confidence. And y'all, I'm into this video as much as I don't want to. Thank you for looking looking at me, not listening to me, looking at me. Thank you for looking at me and listening to me. If you've made it to the end of this episode, drop down in the comments any questions that you have for new coming episodes. This weekend on Saturday, I will be doing a Barnes and Noble date with some of my evolved healthcare professionals. We're going on a Barnes and Noble date and then going to Cheesecake Factory after, because even though people don't like Cheesecake Factory, we do. We like the Cheesecake Factory. And so that's what we'll be doing this weekend as one of the events that we're doing. As far as us getting together, we'll be doing more events coming up, and I will start rolling those out into a newsletter once I get like my true website up. Right now you can go to my Stand store and download the nurse externship. It's free. It's for the free 99 before my nursing girlies and boys, or ladies and gentlemen. I do have a nurse externship booklet that just tells you the ins and outs of getting an externship, what it looks like to get an externship, and how to find them, because I know a lot of times people just don't put in the application because they feel like they don't have the required skills or knowledge or GPA. And I'm here to tell you, a GPA never stopped me from doing nothing. And you can go on my TikTok and you can see what I mean by that. But follow me on Instagram at the Evolved Nurse and TikTok. We also have Nurses Evolving on Facebook. And if you have any questions or a scenario that you would like for me to put out for you, because I think I'm going to start like a little segment in my episodes that like a story time. And if you want to tell me a story time about a time where you had something going on at work and you want to talk about it, just drop it in the email. It's theevolvednurse@gmail.com. And y'all have a great day. And I appreciate y'all for listening to me, talking to me, communicating with me. This has not been an easy journey, but I enjoy doing it. And my why for doing this is because I wanted to build a nursing community for people who look like me, who struggled like me, who didn't struggle, but they also don't really know if they want to stay in nursing. Go listen to some of our episodes. We have people who don't even use their nursing degree. They became a nurse and now they're making 6 figures at doing lashes. My rich lashes, look. But she keep that license up to date so that she's able to, if she want to go dib and dab in nursing every now and then, she does that. There are people who, they are teachers. Their pathway didn't look like traditional pathways. So I like to interview people who are non-traditional, traditional, as well as bridging the gap between people who are not nurses, but we work with they work with nurses. It's a collaborative function. So how do we make life better for each other during this time? So with that being said, y'all, I am out of here. I'm going to do some homework. I'm going to be a mom. And y'all have a great night. And I hope that you see this. It's Sunday, so hopefully it's going to come out in a few minutes. Bye.